Hi, my name is Callum Hills, and today I'm going to talk about physiological and psychological response to sports injuries. Okay, the physiological response to an injury. So when an injury takes place, the potential and to repair and protect the damaged tissue. There are a number of ways when the body responds to an injury. Response to an injury will be pain, swelling, redness, reduce of movement. The initial response of an injury increased blood supply to the tissue, which helps healing process. White blood cells also help fight the infection and help with the clotting. So basically when an injury happens, the tissue gets damaged quite badly, so what happens, the blood rushes to that muscle tissue, and also the white blood cells help it to prevent the injury getting worse, and also stop the clot to help protect the injury so no infections can get into it. Okay, so remodeling of the scar tissue. So the scar tissue restores the tissue at the site of the injury and close it as possible to it as on the original state. The time when the injury takes place, the scar tissue starts to form. It's crucial that the correct treatment and applied to regard the original function of the body part. So basically, what it means, if the injury is not treatable quickly enough or not treated properly, the injury can even get worse. Scar tissues help to close the muscle tissue as the remodeling starts to proceed, so the injury doesn't get worse or doesn't get affected, like I said in the last slide, but also it starts to remodel and starts to repair, and that's how what's called scar tissue. Tissue damage. Hard tissues are the bones, the joints and the cartilages. Hard tissue injuries include fractures, dislocations and cartilages injuries. Soft tissue injuries are to the muscle, tendons, ligaments. A haptomedon is a pocket of collagen of blood caused by the bleeding to the primary area of the body. Is caused by the muscle impact or rupture. So basically, in more detail of that, it's basically when a muscle is ruptured or impacted in whatever situation in sport. Basically, the blood is cut, the blood is split open, and all the blood is caused by bleeding. So there'll be blood coming out the muscle in the primary area, which could be your quadricep, your bicep, your tricep, or your hamstrings. And what that means is as it ruptures, blood will start to pour out in the muscles. Okay, so I'll go on for an injury. Sprained ankle. Cause of sprained ankle could be sudden twist of the joint movement outside its normal range of movement. Sprain is often found in the ankle, wrist or knee. 3 types of degrees of straining. First degree straining is stretching of the ligament, no tear. So what that means, you stretch the ligament but there's no tear. Second degree sprain is potential tear of the ligament, so the second degree is a slight tear of the ligament but not a huge tear. And third and finally, complete tear of the ligament or detachment of the ligament from the bone. So basically what that means, the ligament is actually detached from the bone and the ligament is completely torn. The healing and repair stage. So inflammatory response to as soon as the injury takes place, the start of the healing property into the blood can cause the injury part of the body when being simultaneously disposing of the injury by pro. Repair phase after a few hours of the injury and can last up to 6 weeks, 6 ways. The signs and symptoms are similar to the inflammatory response pursues. Rebuilding the damaged structure and healing the damaged areas. Scar tissue will develop during the phase. Remodeling phase, scar tissue is developed with intake of the original structural period to the injury and improper care given to the injury. So basically I'm going to expand a bit more on that. Basically the first phase is basically the blood can access, so basically what happens when an injury takes place, the blood can access the to the injury, so blood flow can get to the injury. The second phase of it, after a few hours or it can last up to 6 weeks, the signs and symptoms are similar. So basically what it means, the signs can be pain, shouting, pain, bone sticking out a leg, redness or bruising. Symptoms can be someone screaming, pain, redness of the face, The phase of suppression can also be another one. And remodeling phase is basically the scar tissue development. Giving it basically the third, it's like it starts to remodel back to its usual way and starts slowly remodels to the way how our body works. So next bit I'm going to talk about psychological response. When picking up an injury, it can cause stress to the athlete. How does the athlete react and cope with the injury? Stress and anxiety. If an athlete picks up an injury during a competition, then if they suffer injury, the feelings will be increased as they progression of the injury. The sporting prospect can be a psychological issue. Frustration. If an athlete in the recovery stage, he'll be frustrated by not being able to train or play matches. So frustration can also affect an athlete psychologically, because he wants to be playing and wants to be training. So obviously he'll be frustrated because he can't do any of things as he's being injured. Response to treatment and rehabilitation. So how can an athlete, when an athlete's going through rehabilitation, goal settings can help athletes stay motivated and also used for keeping track to progress and see improvements that have been made. Motivation for athletes is really important. If they got a long recovery from an injury or struggling with motivation issues, and give them confidence and motivation tips. So basically, goal settings can be short-term, long-term, achievable, short-term and long-term. So having their goal setting can help improve an athlete and also keep track of what's been made and what else they can improve on. Motivation is really important in sport, I feel, and it's also good to motivate yourself, it will motivate you to get back into training, motivate you to get even more fitter and make a good speedy recovery. Okay, so basically what will happen for a physiological and psychological injury to take place on a sports field. So psychological will be when an injury takes place, the body responds to the damaged tissue, like I said before, and the blood clots to take the healing process. Sports injuries can include frustration when playing football, which is called acute injury. Acute injury is basically when it happens during a match. So obviously I went with open fractures. So basically someone could open fractured when playing football, so that's what we call acute injury. Because it's during a match. Psychological, the athlete might try and deny the injury because he wants to return on the pitch, and can also be angered towards the other player for the cause of the injury and trying to seek payback. So basically the psychological of the injury could be the player is trying to deny it because it's such a big sporting event and he wants to carry on playing and wants to make it name for himself, or wants to do proud for his coach or family. And also a bit of anger could be in there as well, because the player who fouled him, he might want to seek revenge and try and injure the player itself. Okay, now I'm going to demonstrate for you first aid in sports injury. So I'm going to ask Adam to come over, and I'm going to ask him if he can go on the floor. So for this first one I'm going to show is how to approach an injury if a player's gone down, for example, poor hamstring or sprained ankle or damage. So the first thing I'll do is go to Adam and say, alright Adam, how are you?
I'm alright, I think I've done something to my hamstring.
Your hamstring, okay?
Yeah, my right one.
Your right hamstring, okay?
Yeah.
So, how do you, alright, so, okay, so I can start, so if there's any bruising, just see what the injury is, see if there's any bruising or any swelling starts to go. Okay, so there's only a bit of bruising now, so you can't see any swelling, that's a good thing. Right, the next stage, you want to see if there's any movement, see if, just do a bit of strength and passive movement. So say, I'm going to move your foot slightly towards you, tell me if you start to feel pain.
Yeah, there.
There?
Yeah.
Okay. Right, so basically what I want you to do is lift your knee up slightly, and I want you to push my knee, your leg towards my hand in 3, 2, 1. Okay. How does that feel? You still
Really
feel
sore,
really
yeah.
sore, you start to feel pain, okay. Right, just going to stretch it out. Tell me if you start to feel it.
Yeah, there.
There, okay. So obviously what I've done is moved the hamstring to see if there's any pain or movement. Next stage I'll ask Adam to see if he can carry on. So Adam, are you able to carry on or do you need to be coming off?
I think I need to come off.
Okay, so obviously the players can't carry on with the match, so I'll take the decision to take Adam off and make sure he's okay. Okay, the next first aid injury I'm going to do is concussion, or if a player's completely passed out. So, and if you just want to pretend if you passed out. So obviously I've seen a player gone down the floor. He's obviously not moving or anything. So what the first thing I'm going to do is rush over to see if Adam responds. So Adam. Okay, there's no response. So what I'll do then is see if there's any voice or if I can hear any airways coming through the mouth. So okay, I can hear airways coming through his mouth and nose. So that's a good thing. So obviously he's breathing. I'll give a bit of pressure or pain to the fingers. See if he responds. Okay, there's no response. So unresponsive. So what I'll do is ask someone to call an ambulance and tell them we need medical attention straight away. So for this bit, what I'll do is get Adam's leg over to one side, like that. Have the other leg like that. Have his hand on his cheek like that, and literally push him across to the other side. Hand on cheek still. Make sure the leg's properly over. And just wait for an ambulance to come and wait for him to see medical attention. And that's the end of my presentation of physiological and psychological of injuries.